Thank you for joining me. I'm Dr. Phyllis Books, and I'd like to tell you about a therapy I've developed. It's called Books Neural Therapy, and it could change your life. I say this because it's already changed the lives of thousands of people around the world, just like you. Books Neural Therapy stimulates specific brain areas using a very light acupressure-like touch to various places on the head and the body. And this helps reorganize and synchronize the brain and the body.
The basis of learning for children that are dyslexic is that there are certain vacancies, certain networks of neurons that have to be selected and then instructed. And once we select those networks and we instruct them, if we can repeat the process again, we're all of a sudden causing a brain to work more holistically.
The brain is an amazing organ capable of innovation and discovery. Sometimes it's forced to work at less than optimal conditions. From anatomical or hereditary problems, maybe trauma or grief or head injuries. All of these can compromise the brain's ability to actually function well and force the brain into survival, where learning is a luxury. But the brain can be reprogrammed to reverse these effects. The medical and educational community will tell you that dyslexia is permanent, but they're basing that on a definition drafted more than 100 years ago. The medical community believed that once your brain was finished developing, it was done and couldn't change. Today we know that's just not true. The brain can be taught to do new things, can be reprogrammed and rewired until the day we die. It's called neuroplasticity.
I was determined to crack the code on why the children and the adults weren't getting the message, why the message was sent here wasn't being delivered over here. And that's when the light bulb started going off. And that's when I started putting Books Neural Therapy together. And the first time it actually worked, when I completed the whole series on my first patient, I was in awe. It was a miracle to me. And the patient felt exactly the same way. Books Neural Therapy has completed 2 of 3 phases of research. Phase 1 was done in 2001 with 24 randomly selected children in the ages of 8 to 18 in Santa Barbara County in California. 3 kinds of tests were administered: the Wide Range Achievement Test for reading, writing, and math, the Bruininks-Oseretsky for gross and fine motor skills, and the Test of Variable Attention for visual and auditory distraction. The average change was 17.2% across the board with 9 hours of therapy. Phase 2 was done in 2012 in Austin, Texas, with 10 children suffering from dyslexia, ages 13 to 17. This time the QEEG was added to show changes in brainwave activity. The improvements in the cognitive scores were much more dramatic, with an average increase of 3 grade levels in 18 days. In spite of the dramatic changes in the academic scores, as well as improved athletic abilities, the QEEG showed very little changes at the surface of the brain. This is consistent with my theory that Books Neural Therapy reaches deeper into the architecture of the brain. Phase 3 of research is to conduct studies using the QEEG's new Loretta analysis to measure changes deeper in the brain, and specifically those areas involved with dyslexia. These studies can become the dissertation topics of doctoral candidates at Quantum University.
So as a reading specialist and a classroom teacher, I really believe that the key to understanding and helping these kids with learning differences is to integrate Books Neural Therapy with the learning strategies.
Combining the QEEG Loretta analysis, the biofeedback treatment, and the Books Neural Therapy can provide a template for setting up private practices for Quantum University graduates, and a practical format for helping children with learning challenges. Let's create a new day and a new life for children everywhere.